I spent the last years of my nursing career working to ensure my cancer patients had the best treatment possible.
Lynn dedicated her career to helping cancer patients.
Now, I'm terrified I won't be able to obtain those same resources for myself.
And now in retirement, she's speaking up for others while navigating her own diagnosis. Lynn's career as a nurse is actually what led to her diagnosis of chronic lymphocytic leukemia, or CLL, back in 2012.
The nurses in our treatment room, in our oncology infusion room, had low white counts, all of them. We don't know why. So they asked me to go have my blood drawn, and my white blood cell count and everything else was high, was very high. So I made an appointment to see my oncologist, and he said, Lynn, you've likely had CLL for more than 10 years, and nobody picked up on it.
Lynn was originally on watch and wait, meaning doctors decided her condition had not progressed far enough for her to begin treatment. But starting chemo was rough. She ended up in the hospital after her first round of chemo. The FDA had approved BTK inhibitors, a class of drugs that could be taken as a daily pill. But while starting that treatment, Lynn learned she had lung cancer. Surgery to remove it was successful, and she was able to go back to taking her pill. But it came at a staggering cost.
I really just want to throw up. It's either take this pill or I'm going to die.
She took her story to national news outlets and even lawmakers.
I had the opportunity to speak before Congress at one point to Speaker Pelosi.
Lynn used her voice to speak up about financial toxicity, the burden on patients and caregivers to handle the high cost of cancer treatment.
It's now $17,000 a year. And who could afford it? Nobody, not even a retired RN.
Lynn's experience as a nurse navigator helped her figure out how to pay for her own treatment. She found grants to cover her medication. And despite the struggles, Lynn says she's grateful.
I realized that it was a chronic illness and that there was no cure. And I was not upset at all. I compare this with insulin-dependent type 1 diabetes. My daughter has type 1 diabetes. She's had it since she is 12. She's 55, thank God, and she is very well controlled. She can't live without that medication. Better to take medication for the rest of your life than to succumb to something that is perfectly treatable.
She hopes to see a cure for CLL in her lifetime.
You know, doctors are promising with other combinations 4 or 5 or even more years of remission from CLL, but that wouldn't be good enough for me. Remission for life is the ultimate goal. I think we're going to get there in my lifetime.
Helping patients find the right treatments is what motivates CLL Specialist, like Dr. Nicole Lamana from Columbia University.
I love taking care of this disease and really patients with this disease and trying to obviously figure out therapies that will improve your life and the quality of your life. Now we have really good options for patients. Some patients, if they want, could take a chronic continuous therapy, and we'll talk about that. Or some people could take a time-limited therapy. And this really does become a discussion between your provider and you, because the good news is these are really great treatment options, both of them.
Dr. Lamana recommends CLL patients find specialists.
You know, I think it's always good to touch base with a CLL specialist and have them part of your team because they can be helpful. They can, bring up treatment ideas that maybe the local physician hasn't thought of or can partner with the local physician. This is a rare disease. So most of the doctors in the community, and I am not knocking the community docs. They work really hard, but they might see a variety of different diseases. And so they, understandably so, I don't want to treat breast cancer. I'm not a breast cancer doc. So they may not know the most up-to-date information about CLL per se if they're treating many, many diseases.
She wants patients to be open-minded about clinical trials.
I think that there's a big misconception out there about clinical trials. We can only move the field forward through clinical trials.
Well, my doctor was head of the research department at our hospital. I would be open to it, but for me, I think because I'm stable, I'm not willing to give it a chance. I have so many comorbidities, but I do support clinical research. I do support people getting involved in trials. I think those are for people with much less comorbidities or other medical issues, and those that are younger.
Dr. Lamanna wants all patients to feel empowered and prepared.
So it's always important to write a list down, because you don't always remember when you go to the office, and then you're maybe you're a little scared. You just had your blood drawn, you forget things, so you're anxious, totally normal during a visit. But you might forget things. So always bring a list of questions.
Lynn is no longer anxious about her CLL. An avid photographer, she's enjoying her life in retirement in upstate New York.
I call the center of the flower the heart of the matter. And in its uniqueness, it often has patterns, like the sunflower. It's concentric, like the bearded iris that has its tongue sticking out. I love hummingbirds as well, and I enjoy them even if it's from May through September. I feed them. I have such wonderment about God's tiniest creation, and a bird that can hover and as well as sit still. I appreciate the beauty of life and the fact that I am alive.
She also leans into the support she gets from her daughter, grandson, partner, and friends.
I have a significant other, Bob, who's extremely supportive because I can no longer drive. He takes me to all my many appointments. And I just saw my oncologist as well. He has been very supportive. My very best friends, one was the oncology pharmacist, and my other is also an RN. And so they are both very, very supportive. And I have friends that have been nurses and worked at cancer centers and have ultimately gotten some type of cancer. So, yeah, thankfully we know what to do. We don't freak out about it as much as some individuals.
And advocacy is always a part of Lynn's life. She's still teaching patients, now in Facebook groups and other communities.
I am an expert in healthcare, so I advise people and try to teach them about the ABCs of Medicare. It's actually A, B, C, D, E, F. It's quite complex, but I try to simplify it for people. You have to look, especially when you're going for insurance, that especially at 65, where you may or may not be able to change your original decision depending on where you live, to look at your family, to look at your lifestyle.
Lynn says her keys to a happy and healthy life are enjoying the everyday moments, staying informed, and doing what you can to help others.
I could walk across the parking lot and get run over by a delivery truck. So every day you have to live life to its fullest, no matter what your health issues are. You have to take the best care of your health to the best of your ability and what we know in medical science. But it's a tough world that we are all living in now. So I think once you have support from even one person, they can make all the difference in the world. Kindness goes very far.
Lynn, thank you so much for sharing your story, for all that you do to advocate for other patients, and for helping us to humanize cancer. If you enjoy watching Lynn's story, then I know that you will also enjoy the story that we have queued up for you next, right here. And after you watch that, be sure to check out this playlist as well. Thank you for taking the time to watch this. Be sure to subscribe to The Patient Story and share this with someone else who could use a little bit of inspiration today.